All right. Thanks so much for being on this podcast. My first question that I have for you is, tell the audience a little bit about yourself and how you got started in the role that you are today.
Okay, yay. Thank you so much for having me. My name is Dr. Chante. My credentials are DBH LPC, and I've got license in multiple states. I need to mention California 11292. I'm a Black and Filipino therapist. I specialize in treating trauma and attachment. I have a private practice in Tempe, Arizona. Like I said, I am licensed in multiple states, so I provide in-person and virtual sessions. My specialty is EMDR. An EMDR therapist. I recently added ketamine assisted psychotherapy and ketamine assisted EMDR therapy to my practice. I see all adults, a lot of BIPOC, first responders, and my approach is to be authentic and collaborative, meeting people where they're at, which just means that I integrate culture, creativity, and I just adapt therapy to really fit the person and the individual. At the heart of my work is connection and healing in ways that feel authentic and accessible for everyone. So that's a little bit about me. Yeah.
hmm So you said you work with attachment and trauma, so could you talk a little bit about those?
Yeah, so I have been taught that trauma is a threat that you weren't prepared to handle. So just basically to normalize that and not to minimize or like blow it up, but like everybody experiences some form of trauma in their own definition. And attachment is the relationship you have with your parent or primary caregiver, whoever raised you, and that's the lens that you see the world through. So sometimes there's attachment trauma, a lot of times. And so I help people work through the trauma that they've experienced, their attachment wounds, and to, like I said, co-collaboratively create their treatment so that they find meaning or make meaning in the experiences that they've been through and to create a life that they love living. They
hmm
get to heal
And
all of that.
I remember taking an attachment style quiz. I don't know if you've heard of it, but it's like this quiz where they ask you these questions: How good are you with your parents? How good are you with, yourself? All those kinds of things. And what I found was because I took it myself was that I had a secure attachment style,
Yay.
which
Okay.
which it's pretty rare that folks develop a secure attachment style, but that's what I found in taking that.
I got to be honest, I'm a little jealous. And I do feel like we have a little bit of all the different attachment styles in us, or like different relationships or partnerships can evoke different things. So I'm glad that you have secure starting out. You know what I mean? It's a
Yeah,
good thing.
because not everybody like has that attachment style.
No. Mm-mm. So that's cool.
It is kind of cool. So tell me a little bit about the modalities that you use both in the trauma aspect, but also the attachment aspect as well.
You know, it's an interesting thing because I think in grad school we learned about the therapeutic relationship and how at the end of the day, like that's the thing that produces the best outcomes. So when you think about attachment, it always goes back to the relationship. And sometimes, because of my own stuff, my own history of things, I'm like, oh, like what am I not doing? What needs to happen so that I can help this person heal? And I remember and forget often, like, no, it goes back to the relationship. So I definitely utilize that in all aspects of what I do. And I also believe, because I am an EMDR therapist, and that's the therapeutic lens that I use or modality. People wouldn't do the EMDR stuff unless we had that relationship already established. So I do EMDR therapy. I'm not sure what you know about it. It's my jam. It's my favorite thing. You got it. Okay. It
Y-
stands for eye movement desensitization and reprocessing. Um, that's how I see the world. That's how I see treatment in that way, is to work through healing in that regard. And there's different aspects. I think when people think about EMDR, they just think about the reprocessing portion, which is the eye movements or the buzzies.
hmm
But there are several different phases of EMDR therapy. So I use that for trauma and attachment treatment. I'm like, did I answer them all? And then, oh, sorry, you also asked about the other modalities. So I just recently added CAP, which is ketamine assisted psychotherapy. So that's adding ketamine as a medicine into the treatment. And those results are so different and interesting, and they vary from person to person and session to session. And then along with that, I've combined and I've gotten trained in ketamine assisted EMDR therapy, which is trademarked, and they're doing a bunch of research on it. And to me, it's a game changer. So it's adding ketamine into an EMDR session and helping that to help people heal, it's kind of amazing.
Yeah,
Yeah.
which one's been your favorite?
I don't even know.
Hmm.
I that's a really good question. I don't know because they're different and I like them both and I feel or I like all of the things, but I like whatever is going to help the person heal. Whatever is going to help clear out what needs to be cleared out and let go of and make meaning, you know. And sometimes I think what I'm also learning is it's the sometimes an injury just needs to be witnessed. You know what I mean? Like
Hmm.
somebody just needs to see it and that helps people heal. That kind of trips me out, but it helps and it's working. So I
Hmm.
know that I
What
have
are
a
some of the common themes that you notice in your sessions with clients?
it's funny. So I also with therapy do a lot of like consultation. I used to do supervision. So I see other therapists who are seeing therapists too. And something I say often is like, you know, it's going to show up on your couch. So when I say that, it's kind of like whatever I'm going through sometimes gets mirrored on the couch, or whatever somebody's going through, you know, also gets mirrored. I guess I would say because of who I am, it's like anxiety, depression, trauma. And those are like, I don't know, kind of overarching themes, but typically that's what it is, if that helps. And then just kind of I don't know, untangling that to see like where the root of it is so that we can better assist them in healing the root of the issue or the concern or the trauma. I don't know
Hmm.
if I answered, but you got it, I
Yeah,
think.
yeah, you answered it pretty well.
Okay.
My next question is, like, what have you learned in doing this kind of work?
I mean, so much. I don't know. I think I've learned that people are who they are. People only change if they want to change. I learned a lot. I guess maybe when I do treatment, like EMDR gives me the template, but the client, the patient, the person is going to teach you about them. And I feel like even though I knew that, like I'm still learning that and still learning about people and the individual.
Hmm. Is
Yeah.
there anything that you sort of was there like some sort of mentor or someone in your career that sort of guided you to where you were today?
So many mentors, so many people, right? And I think I'm still seeking out consultation and growth and support in that way. Definitely a lot of EMDR therapists who help to kind of I guess hold my hand through it like in the beginning stages. EMDR, I got into it when there weren't a whole lot of clinicians doing it, like it was still relatively new. And then that helped me to have some of these supports, and then I wanted to you know pay it forward and also assist people in that way. So that is something else about me. You know, like I said, I do consultation. I'm really big about community and connecting and creating a community. And like if I know some things, I definitely want to share that with people. And I'm like that. Like I like have harassed everyone in my circle about ketamine and therapists getting trained and clients, have you considered it? Just because I think that it is such an amazing way to get treatment and to do treatment. So sorry, I kind of forgot where we started with this.
Hmm. Oh no, that's okay. What I wanted to ask is like since you work with BIPOC and since you work in the trauma aspect and the attachment style, what have you learned in sort of the data behind it? Have you dug into the research between that correlation, between BIPOC individuals and their um level of trauma and attachment?
Um, yes and no, because I also feel like I'm living it. You know what I mean? Like I feel like the intergenerational trauma and epigenetics is real. And I definitely feel like Black, Indigenous people of color are facing systems within systems, and like we're working through all of that. So, like the exact research, not really, you know, like I don't have the statistics, but I can tell you that I do work with a lot of people who are fighting all of those things: the trauma, the attachment wounds, the breaking up of families and systems within our family systems, and then also outside of the family, the different systems that are set up that weren't meant for us to succeed, you know. Those are all the different things that we're also facing on top of regular stuff like you know, depression, anxiety, feeling uncomfortable, like I don't belong, the different negative beliefs or cognitive distortions that everyone's facing systemically, individually. I see it all.
Hmm. And so,
Yeah.
because what I was going to ask is, have you what have you heard in terms of like your work with BIPOC individuals in your sessions? Because I imagine they're sort of what's the word I'm looking for? They're sort of different or like yeah.
Um, can you repeat the question a little bit? Like how they see things, or
What I'm asking is, you know, in your sessions with BIPOC individuals, what have you noticed?
what have I noticed? I mean, there are some reoccurring themes, you know, the current climate shifts often. And so that's part of some of the things that are coming up in our sessions. Um, and sometimes when we talk about things, you know, because it can be daunting and overwhelming to have to try to work within these systems or try to reform the systems. And I often go back to like the individual, like, okay, so what can you do? Right. And same for me, because it can feel pretty powerless. So what can I do is I can help remind people that they can do what they can do. And so work from the individual out, which sometimes feels empowering and sometimes still feels a little bit powerless. But I definitely see that in sessions with people.
Hmm. And lastly, you know, what advice would you give to those, you know, who are wanting to study um attachment and trauma, but with a BIPOC lens? You know, what advice would you give to those people?
I would definitely encourage education, but not just like traditional school education. I would also advise to like incorporate books and podcasts and just do the research. I do think that there is some healing within that that could happen, but I guess I would also recommend, and I think it's because I'm biased and I'm a therapist, for everyone to get into their own therapy and seek their own treatment and healing around these things, because I think that that could also help to shape their lens and how they could be educated with all of the things and healing through it and growing in that way, if that makes sense.
Yeah, it does.
Okay.
All righty.